Here we go. For purposes of the recording, welcome everyone. I'm Cody Barnett, Bodyworks Physical Therapy.
And I'm Dr. Damian Heiser at Bodyworks Physical Therapy.
And we are here tonight to talk about foot pain, heel pain, plantar fasciitis, Achilles problems, and such. And these are the things that we specialize in. These are the things that we enjoy working with people. These are the things that we enjoy seeing people recover from, because it can have just huge effects in terms of other things in our life. If our foot hurts, something simple that causes us to limp or causes us to not be as active, can certainly cause a lot of other health problems downstream. So it's something that we really get a lot of joy and satisfaction out of helping people solve these problems. So we appreciate everybody for making the time to join us tonight. And we love to teach and we love to learn. And we know that everybody here obviously cares about their health. Otherwise, you wouldn't be here. So we're thankful that you're joining us tonight. Getting started. So here's kind of some of the common things that we hear people say when they come into the office, or they come in and say, hey, here's what's going on with me. It's, golly, I am trying to be more active. I've started an exercise program and I was doing really well. I got really excited. I was being really consistent and regular with it. And then, golly, my foot started hurting. And then, I've had to backtrack. I can't be as active, can't do the exercise I was doing. I lost 5 pounds and now I'm stuck because, this is going on. The other thing is for people that are regular walkers or runners that are dependent on that form of exercise for mental health purposes or physical health, that it limits that. And all of a sudden you can't be doing the things that you enjoy doing for recreational and stress relief. That's a big common one. Another thing is oh golly, we've got this trip to Disney World planned in a month, and I can't walk, and I got to be able to walk 10 miles around Disney World. So that's a common thing. And other questions that we get a lot is why is this happening to me? I've been doing this activity for years and it's never bothered me before. Why is it bothering me now? Why did this start? What have I done? And then our mind starts to kind of go down the proverbial rabbit's hole in terms of, okay, this is really bad. Am I going to live with this forever? Am I going to need surgery? All of these things that just, can be real problematic from a mental mindset sort of a thing is what we run into. And then there's the social aspect of it. For example, maybe you go golfing, or maybe you play pickleball with friends or do things with friends and family. And all of a sudden you find yourself saying no to those activities because of this problem, and you're missing out on the social aspect of it. So those are all real common stories that we hear, and real common frustration with this. And then the other thing is like, what have people already done and tried? So number one is you go visit Dr. Google, look up some YouTube videos, read some Google articles, and so forth, and get that information. And I've tried that stuff and it didn't work. Or, I've been to my doctor, I've done some massage, I've done these exercises I found on YouTube. It's not quite cutting the mustard. I'm not getting any better. I've tried resting. I took 4 weeks off, and it's still there. Those are really, really common things that we hear. And also in terms of, just, medications and, anti-inflammatory drugs and et cetera. So the stuff that we're going to talk about tonight, quite honestly, while anti-inflammatory drugs can sometimes be a little bit helpful, they're certainly not they're certainly not fixing the problem. And so we're going to cover why don't those things fix the problem? Why doesn't rest fix the problem? We're going to cover all of that stuff tonight. So anyway, with that background, I'm going to pass it over to Dr. Damian, and he's going to cover and talk about, what are the different causes, what are the sorts of things that people can have, what are the root causes of those, and cover that stuff.
Yeah, definitely. So, the big thing that a lot of people are going to be walking into our clinic with this kind of a problem is they'll walk in and say, you know, Cody, Damien, my heel hurts. I've had this heel pain going on. And that's at least where it starts, right? Is really this heel pain or maybe this ankle pain that people have going on here. And so, you know, the first thing that we really have to kind of determine is, you know, plantar fascia, what is it? You know, what does that really mean to us? So we're going to kind of bust out a model here for everyone real quick. So kind of bear with us here, but so we've got a model of a foot. This is just a skeletal foot. And what you'll notice here, and I'll get a little bit closer so we can maybe see better, is you'll see this thickening right here that I'm kind of pulling on the bottom of the foot. And so what this is this is the plantar fascia, and everyone's got this. It's on both feet. And as we can kind of see, it starts down here on the heel bone, and then it goes and it connects up to a lot of the other toes here. And it just helps our foot, our ankle have a lot of support, stability. It's very thick. It really gives our foot a lot of integrity at this point. The problem that can happen here is we can get problems with this fascia. We can get this heel pain that kind of comes with this. And what brings a lot of people into our clinic is this problem with the plantar fascia here. Most of the time it's near the heel. This can kind of move to different areas on the foot here. Typically, it might kind of go more into your arch a little bit here. We don't tend to see it go much into the toes, but really that heel up into the front of the arch there, a lot of people will have complaints of pain there. So, you know, what is it? What is the kind of hallmark signs of this might be a plantar fascia problem? And what tends to happen is kind of like Cody was mentioning, you start a new activity, or maybe if you're someone who is an athlete or you're kind of used to an activity, maybe there's been some sort of change in your load, meaning the amount of ways you're training here. So let's say you're a runner, you took a 2-week break for whatever reason, and then you went back to running the same amount of mileage you did before from that break, and now we're having some heel pain at that point. What's very common with this is one of the big hallmark signs is people will have this severe stabbing. It's like walking on glass. You have to use the furniture. We call it the furniture shuffle to get around your house for the first few steps in the morning because that heel pain is just so severe. And we don't really want to get this mixed up with some soreness and some stiffness. This is pretty rough, pretty bad pain. And people will come and they'll say, you know what, the pain is right there. That's where it's hurting me at when I do that kind of furniture shuffle in the morning. It tends to get better the more we move, but it'll kind of come back near the end of the day or after an activity where it's sore, it's stiff, and there's some pain there at the end of the day. Now, it's not really enough for someone to come into us and say, hey, Cody and Damien, my heel hurts and it hurts right here, or maybe it's more, it's not very pinpoint, it's local, and it's just heel pain. And we have to kind of dig a little bit more into that because, you know, I'll tell a couple of quick stories real quick. I've had a couple of patients come in that I'm treating right now. Both came in, both main complaint of heel pain. Their heel was hurting them. Both were pretty active women in different ways. And they both came in thinking, you know, I think this is plantar fasciitis. I think this is a plantar fascia problem that's causing my heel pain. And really, upon further investigation, luckily for them, it's really not a plantar fascia problem. There's some other things that can be going on here that can mimic a plantar fascia problem. I want to just spend a couple of minutes here talking about them. And a couple of the big ones is, you know, looking at the foot here. Yes, we have this spot in the plantar fascia where it really starts, but there's so many other things that are very intimate with that area. We can get two really big things that happen with that is a nerve entrapment. And one of the patients that I mentioned, that was her problem. She was having some nerve irritation in that area that kind of looked like plantar fasciitis, but our testing didn't corroborate that. And we were able to do some other stuff to find that. Our other gal that I was talking about, she actually had what we call an Achilles tendon problem. So a tendinopathy is what we tend to call that. You know, the symptoms are a little bit similar, but it's kind of the fine details that we kind of look in here to kind of see, hey, what really is going on. And that's really where the root cause of this problem comes in for us here. So I'm going to kind of switch foot models for just a second. So this, we now have a more foot that looks like what everyone else has right now, right? Not just a skeletal foot. And what we'll tend to see with some people is really one of two things. And the first one is, you know, we have someone who maybe their foot is very mobile and they have more of that flat foot. So when they're walking here, you know, as this comes in, this foot really likes to kind of come down. It really kind of what we call pronates. And we get a lot of stress that can be placed on the plantar fascia because of that. So if we kind of see here, the more that we kind of roll in, if you will, the more we can just really stress this point right here for some people. And after so much time, after a lot of activity at that point, that can lead to some problems for people and they start to get symptoms. On the flip side of that, we have some people who, rather than their foot moving and pronating a whole bunch when they're moving or walking, they're the opposite. It's a lot more stiff. They tend to be very stiff-footed. There's not a lot of movement that's going on. And similarly, too much of a good thing we know can be bad, but both ways here, they're not moving as much. That's putting some undue stress on the plantar fascia too. And lo and behold, sometime later we start having some symptoms. So yes, it's great to know, hey, we have a plantar fascia problem, and we really have a lot of great tools to help people get out of pain and problems with that. But really what needs to go beyond, and so we don't have this repeat of a pain problem here, is what's really the root cause of this. And that's where guys like Cody and I come in, because that's what we look at and that's what we kind of keep in mind. And who knows, it may not even be the foot that's the issue. We may have something going on higher up in the chain, if you will, at the knee or at the hip that's going on, that's maybe adding into this problem here. And for a lot of our runners, especially, we may just have we just have some muscle tissue that just isn't up to running at this point, and we just have to kind of get them on a strength program there. That's a really common problem we tend to see too with this stuff. And if we're not able to meet the demands of what running, for instance, looks like, we're going to probably have some sort of breakdown somewhere. And the plantar fascia tends to be a spot that we see a little more often than not here. So,
and on that topic, so in terms of treatment, we might have 5 people with the same diagnosis, right? And certainly there might be some threads of treatment that are similar among those 5 people. But it's really common for all 5 of those people to kind of have a different treatment plan in terms of what we're addressing and what we're working on, because they may have the same pain in the same location, but because they have different mechanics, different root cause, their treatment plans are going to be somewhat different.
Yes.
Right.
Oh, yes. Yeah. Like you said, 5 people come in with a plantar fasciitis or fasciopathy diagnosis, and maybe at the beginning we look kind of similar here in terms of helping with their pain. But in the end goal, maybe person A is having to do a lot of mobility work, person B is doing a lot of strengthening work, and everything in between there. Yeah. And that's where the individual components and that root cause really comes into play here.
Yeah, very good. Yeah, that's a lot of stuff. That's a lot of stuff to cover. So before I go on, that's kind of a lot of things to digest. Does anybody have any questions that they want to throw out just based on what we've covered thus far before we go to our next phase? Feel free to either unmute yourselves and jump on, or feel free to type in the chat. Okay. All right. Perfect. Well, save those questions for later. We'll ask again. Okay. Okay. So then the other question we get asked about a lot, and of course, there's a lot of advertisements on the radio and on television and so forth for foot orthotics. So people are always asking, well, do I need foot orthotics? And with that topic, it's kind of a deeper topic. It's not just a yes or no answer, because it boils down to what Damien was just talking about root cause. So we make a lot of orthotics for people. We have what we feel is the best orthotics lab in America that makes orthotics. So we make a lot, and we make a lot of those. However, that being said, not everybody needs an orthotic, and it boils down to what's the root cause. Is this foot and ankle problem because I've got some weakness in a hip? Well, if we address that weakness in the hip, then that should solve our problem. So it boils down to what really is the root cause and what's happening here. And that answers the question about the orthotics. The other thing with orthotics is that there's a wide gap, or a wide variety of quality of those. So on the low end would be your Dr. Scholl's from the local drugstore. On the high end would be more of what we do, but then there's everything in between. And so quite frankly, there's people that come in with devices in their shoes that really, quite frankly, are not quite up to snuff as far as what they need. And so there's that issue. And then sometimes people don't need a custom foot orthotic. So for example, what we make is a custom foot orthotic that we take a 3-dimensional laser scan of your foot. And then we also, our lab actually makes 3D printed orthotics. And so we have that available. But then we also have some people that don't need that expense or don't need that aggressiveness. And we have some just simple off the shelf insoles and orthotics that we use with people all the time. That's all they need. So in order to determine what you need, it really depends on, looking at the mechanics. Is it a mobility problem, flexibility problem, a strength issue, whatever is the root cause, then that's what we want to focus on. So that's a question that we get an awful lot. The other thing I'm just going to mention for everybody that's on here, because there's a lot of this that's marketed and sold, and that is these foot scans where you stand on a scanning device and it scans your feet while you're standing, while you're putting weight on your feet. And based on that scan and standing, it says, oh, you need this orthotic or that orthotic. I just want you to be wary of those. And the reason that I want you to be wary of them, they're very convenient. They're very convenient, but they're also not biomechanically sound. And what I mean by that is once we stand and once we put weight on our feet, once our feet start to collapse this way with weight and gravity and our body weight and start to go in, well, now our foot shape has actually changed, okay? And so if we're scanning somebody when their foot shape has already changed and deformed, and then we make something to go in that, it's going to only fit and conform to that collapsed shape. And so it's really important that if we are going to do any type of orthotic, that we do that based on what your foot looks like when you're not putting weight on it, what we call non-weight bearing. So for example, sitting or laying down where things are not getting collapsed. So I do want you to be wary about that, because we've seen a proliferation of that. And typically those are the folks that end up coming in and going, well, I got orthotics before, but they haven't done anything for me. Well, it's typically because they've been done off of a weight bearing scan, which quite frankly, once the foot hits the ground, everything is already deformed and changed. So it's not really an accurate way to do that. So anyway, be wary of that. And if you have questions about that ever at any time, feel free to let us know, and we'll hop on a call with you and can talk about that more. So so that's that question. And I know we got a lot of emails asking that question as well. So I wanted to make sure and cover that.
Not a question.
Oh, can these things really be fixed? Can they be fixed?
Absolutely, they can. Absolutely. And I think maybe, and Miriam, this is, I don't want to assume anything about if this is affecting you or any situation that you or a family or a friend is in. But, I would argue with us, we get a lot of that kind of patient who comes in and it's like, I've been dealing with this for a long time. Where I've seen a couple of different providers for this specific issue, and nothing has just worked at this point. And that's where we feel pretty confident, and we feel very fortunate to have some tools, to have some abilities to really take a firmer look into some things and really figure out, hey, what have you tried? Who have you seen? What's worked? What hasn't worked? And how do we kind of sift through that and then really get to some other things potentially that can be really beneficial for you. Plantar fasciitis, plantar fascia problems are definitely one where we see a lot of people get better from them. And especially with things like physical therapy and getting the right kind of stuff there, they get better, which is the good thing. They have a very favorable history. We see a lot of great things happen here. And if a case becomes more chronic, more persistent, then maybe that's just where, hey, we need a little bit more tender loving care, a little bit closer look here to really figure out, what's going on. And kind of like we've alluded to earlier as well, maybe there's a chance this isn't a plantar fascia problem. And that's where some of those other diagnoses need to be considered so that we can really get to the root cause to help whatever situation you may be in. So, in short, they can be fixed, can be helped. You're not cursed to be in pain forever.
Yeah, very, very treatable. And to that point, true plantar fasciitis, true Achilles tendonitis, tendinopathy, don't respond well to surgery. And so it's not to say that there aren't some people that in very, very, very worst case scenarios end up receiving it. But I will say this, it's not really a surgical problem. It's something where conservative treatment, conservative care, the right care can be very helpful.
Yeah.
And, we get people in all the time that's been going on 3 months, 6 months, 12 months, and they get back to their activities that they like to do. So,
and sometimes I think what happens too is, everything is right. The therapy's good, everything's good, but it was maybe just that return to an activity, or it was the return to the thing that was really aggravating that just needs to be looked at a little bit more too. Maybe getting back to that was just too quickly for you. And maybe that return to that activity program or protocol, whatever you'd like to call it, was maybe just too quick, or it was too much too soon. And really, you're in a great spot. We just kind of have to pull the reins back on you a little bit and more gradually get you back to what you want to do, which I'd argue is something we commonly see with people, because we tend to be our own worst enemies sometimes. And we want to get back to the things that we love to do. And sometimes we tend to overdo it sometimes and go a little bit too hard. And that's where we can be really great. And people who maybe have been on athletic teams and had coaches can kind of speak to this, where that person, that coach, us, comes into play and says, hey, let's just take a step back. Let's rest a little bit more. Let's be a little bit more methodical about this to have success at that point.
Yeah, good question. Thank you, Marion. And so I'm going to go, if anybody has other questions, feel free to type them in the chat. We would love to entertain those. And then I'm going to go ahead while you're thinking on that. I'm going to go ahead and read one of the emails we got. So this one is, I've tried rest and I've tried ibuprofen. When I do that, the pain goes away. But then when I start walking again, the pain comes back. What should I do? So that is a really, really, really common thing with this. We hear this all the time. I was doing activity X, whatever activity X is for you. So I thought, well, I just need to stop that for a while. So I stopped for 4 weeks or 8 weeks or whatever. And then it got better. And then I went back to that activity and bam, it's like it never left. It's still there. And the reason that happens is because the tissue that we have, the connective tissue that we have in those areas, literally goes through a change in its integrity in that area. And so part of our treatment that we do is how do we restore that integrity so that the tissues can then tolerate the increased load from the activity. And so that's a really, really common problem that we run into. But with the right loads and the right dosage and the right timeframes, we can increase that ability and that ability, the what I'll call the robustness, the ability for that tissue to tolerate more activity and more load. But it is definitely a building block process that has to happen. So that's a really, really common question that we get. And then I'm going to read another email. I've been walking 1 to 5 miles almost daily for over 50 years, which is awesome. Kudos to you. I never had any foot pain, but for the last several months, I've been having excruciating heel pain, no swelling on my right foot. My left foot has no pain, but is puffy on the top. When I'm out walking, neither foot bothers me, which this is really common too. But I don't wear my shoes in the house, and we have hard ceramic tile floors in the kitchen. So, and there's more to this, but I'm going to pause there for a second. So it is very common with these Achilles and plantar fascia types of problems for people to have minimal to no pain during the activity, because the tissues loosen up, we get warmed up, we get more blood flow, things feel relatively better. And then what happens, we go and after our exercise or our workout, we go and sit on the couch, or we sit at the kitchen table or something like that where we rest, and then those tissues get cold, the blood flow goes away, things tighten up, or we go to bed that night, we wake up the next morning, and as we take those first few steps, then that tissue gets pulled on again, and it's, what did I do? We're doing reaching for the furniture shuffle. So that's very, very common for that to be relatively better with activity, but then worse when we rest or sleep. And so getting back to the email, what should I wear in the house? So, so for standing on the hard ceramic tile floors, quite frankly, with the bare foot, those feet are collapsing. Like Damien showed on the model, that stuff gets smushed, so to speak, a little bit, and then pressure at the base of the heel. So some good supportive shoes. And then what kind of flooring would be better for my feet? I'm going to say we don't need to change the floor. We need to change the shoes probably that you're wearing on the floor. And that would be a lot less expensive than new floors, right? Anyway, we would be happy to have a further conversation on those details with you to cover more of the details there. But as everything that you're describing there is really, really common, and we just need to take a look and get down to brass tacks and take a look at it and solve it. And especially with, obviously, that's something that you enjoy. That walk is good for health, good for mental health, and so forth. So we need to have more conversation on that. Yeah. Okay, we got another question. I'll let you read it because you could probably see it better.
Sure. So this is from Miriam. I have flat feet and had a hip replacement a few years ago. You mentioned that someone might have a hip weakness. Are you able to analyze the whole body to see if it is more than a foot problem? Can you provide treatment for a part of the body that is not the foot, but it affects the foot? So
absolutely.
Yeah.
We only do that every day. We only do that every hour of every day. Yeah, that's a really, really good question. So, and it's really common after a hip replacement because with a hip replacement, you have the recovery post hip replacement, and which, quite frankly, not everybody gets their strength back like they should. And then secondarily, however long that hip was bothering you before you had it replaced. So let's say that hip was going bad for a year or two. So then you lose some range of motion and some strength even before the replacement. And then you have the replacement, you have to recover from the surgery. And so it's really common to see some deficits there. And it's so one of the things that we do when you come in is that's like for anybody, not just in your case, but for anybody that walks in the door with a problem like this, we're always checking things like hip strength, spinal strength, hip mobility, range of motion, knee. If we're looking at a foot, we're also going to be looking at a knee. We're going to be looking at a hip. We're going to be looking at back, everything all the way up to body, because all of that stuff is crucial for, again, getting to the root cause of the problem and fixing that.
Yeah. And even just outside of this case, with some of these issues like plantar fascia and more tendon related issues that act this way, we tend to see truly some changes throughout the rest of that entire part of the body. And very, very frequently we don't just ever really treat the foot, or we don't ever just really treat that specific thing. We kind of treat the entirety of that part of the body, because we just know, hey, there are some changes that happen here truly because of this issue. The body is really, really good at finding the path of least resistance and, trying to be as efficient as possible, even if it means kind of changing some stuff up there. And it's also really good at offloading itself too. I.e. if you broke a bone, you kind of know how that kind of goes, right? Granted, this is nowhere near as traumatic or severe, but it definitely follows that. And like Cody said, we're kind of treating everything at that point. We're figuring out some root causes. We're kind of seeing why did this happen in the first place, but we also understand how this affects some other things here. And that kind of goes into the program for a person, or into that home program for you specifically. So, even with your case, Miriam, it kind of sounds like there's a bit of a double whammy with this thing for sure. And potentially maybe it's even more than the foot. Maybe the foot isn't the problem. And that's where we just have to have that kind of time to see.
Yeah. Or, sometimes because your foot hurts, so you limp and you gimp around a little bit, and you do that long enough. And so then as you're limping around and gimping around, then something else starts to hurt. A knee or a knee gets sore, a hip gets sore, a back gets sore. That happens a lot.
Yeah.
The foot bone is connected to the leg bone. And it's a song we learned as kids, but it's very, very accurate. Like that we see that a lot. Okay, any other questions anybody wants to throw out?
Yeah, what other questions do we have?
Feel free to either jump on and unmute yourselves or put it in the chat.
So
Where are we located? Great.
Yeah.
Yeah, we're going to give you that here just in 2 seconds. We're 7015 East Central, which is halfway between Woodlawn and Rock on Central. Yeah, in Wichita. And actually, maybe I need to point that out. We're in Wichita. We do have a lot of people that signed up. They're actually not in the Wichita area. So, and we do, if need be, we do video, virtual video appointments as well. So for those that aren't physically in Wichita, we'd be happy to chat with you more about that. Any other questions? Okay. Well, let's talk about next steps. So that's the proverbial next steps, since we're talking about the feet, right? Like we talked, this is a really, really common problem. The reason that we do these webinars every month is quite simply because we know, and so that's why we do these. In terms of everybody that's on the call, looks like we lost your internet for a second there. I'm going to back up. Looks like our internet went goofy for a second. As far as everybody that's on the call or watching that you wouldn't have signed up, you wouldn't be here if you didn't care about your health and that you're having some sort of problem. And the question I would respectfully ask is if I don't fix this problem, what does this look like down the road for me? 3 months, 6 months, 12 months. If I can't do the activities I like to do, if this is keeping me from doing stuff with my family or the things that I enjoy or the things that bring me joy in life, what does this look like if you don't do something about it? And unfortunately, that's how a lot of people are by the time they get to us, is they've been struggling for a long time and having trouble for a long time. And because of that, it's affected other areas of their life. And that's kind of the hard part of our job, is when that happens. So with that said, we are offering a couple of different options for everybody that's on the call or watching the replay. Option A costs absolutely $0. And that is, if you just want to have a conversation with us to talk about your unique situation, we'd be happy to jump on either a phone call or a video chat with you to learn more about your situation, what's going on, what are some of the details of that, listen to your story. And quite frankly, we don't like to waste people's time or money. So if we think that that's something that we can help and there's something that we can do for you, we will tell you that. If we think that you'd be better served by doing some other treatment or seeing some other provider or anything like that, we'll happily tell you that as well. So if that's interesting to you at all, we're going to put that in the chat. It's basically just a web form that you fill out. And yeah. So if that's something that's interesting, we've got that link in the chat there. And you could just fill that web form out for us, and we'll send that to you, our team will get back with you, and we'll set up a video or a phone chat and just talk about your unique situation. The other option is there's some of you that are on this call and some of you that are familiar with us and know us a bit. So if you're like, crud, I just need to bite the bullet and get in and get this thing checked out and get seen and get something going, get some treatment going for this, then we have an option for you there as well. And basically what we're doing for anybody over the next 5 days, anybody that's on the webinar, either live or watching the replay, we're offering our full examination and treatment for the first visit at 50% off. It's $124, so it's a savings of $124. And so we've got that option for you. And so if you're just like, dang it, I just need to get going on this and get rolling, there's that option as well. And you save 50% off the first visit. So we're going to put a link in the chat for that as well. And there you can either call us or you can fill out the web form on that, and our team will get with you tomorrow and get that set up. I'm also going to be sending out an email that has that same information in it to you, so you'll get it in an email as well if you're having trouble clicking on it or typing it in tonight. But we do anticipate that email going out after the call. So anyway, 2 options for you. We'd be happy to help any way we can. We are doing one other thing tonight only. So if you want to take advantage of the 50% off, we are asking you to get with us before this coming Friday, which is the 24th. 24th. So you need to get with us before Friday, the 24th of June. However, if you're like, okay, I'm ready to go, I just need to do this. And if you will contact us, either leave us a voicemail on the phone number there, or click on our contact us link that we typed in there, and you're just ready to go. And if you'll contact us tonight, the first 3 people that contact us tonight are actually going to save even more. And we're going to do that first visit and exam for $99. So if that's you, we'd love it to be you. Feel free to reach out, either one of those. And but that part is just for tonight only. So that's kind of what we've got. Oh, we had a question about insurance. Great question. What I would ask you to do is fill out that contact us form, and because insurances vary, but if you will just get with us on one of those links that we've typed in, we'll be happy to visit with you more about the insurance question. So, because that's different for everybody. All right, so any other questions about feet, foot pain, heel pain, Achilles pain, staying active and mobile, anything that's popped into your mind before we take off tonight? All right, we hope this was helpful. If you found it helpful, it gives us juice and it gives us excitement to move forward with other webinars and stuff. But if you found this helpful, if you would give us an emoji, give us a thumbs up in the chat, or something, just to let us know if you found it helpful. We enjoy doing this. We enjoy teaching, and letting people know what options there are. So thank you, appreciate that. All right, so we're right now, we're 2 minutes early. So we're doing well. We're doing good on time. So if nobody has any other questions, thank you, Miriam. We got a thumbs up and we got a heart. We appreciate that. So yeah, anyway, just a reminder, if you want to reach out to us, the links are in the chat. We'll also be sending you an email. If you want to take advantage of any of the options that we have available for this week only. We appreciate everybody, excuse me, for being on. Anything I've forgotten?
No, I think that's pretty good. This is one of those, and really a lot of these foot and ankle problems that we tend to see pretty frequently, regardless of timeline and chronicity, are very much treatable. We can very much make them a lot better for you. Time and time again, a person comes in and they're like, man, am I just doomed for this forever? And fortunately, we get to say, no, you're not. It may not be an overnight fix for some of this stuff, but we can definitely feel very confident saying, hey, we can make this so much better for you. And we know we can appreciate where you're coming from on some stuff. And we just want to be there to help you, get you on your way, so that you can get back to doing the things that you love.
And the first step is just taking a look.
Yep.
You just got to take a look.
Yep.
So in closing, we love to keep people mobile and active and off pain pills. And so if you have any other questions about the stuff tonight, if you have questions about other problems, we also, treat other orthopedic conditions, things like back pain, hip pain, shoulder pain, neck pain, etc. So anything like that, feel free to reach out. We're at bodyworksphysicaltherapy.net, and our phone number 316-558-8808. So always feel free to reach out. We actually still talk on the phone, and you won't get stuck in the phone tree. Press 9, press 2, press 3. You won't get stuck in that with us. So We appreciate everybody for joining us tonight and making the time to hang out with us. So thank you.
Yep. Thank you, everyone.
All right. Until next time. See you, everybody.
Goodbye.